Okay, let's talk about somatoform disorders. This is actually a group of disorders that all have the same general definition. So in general, somatoform disorders occur when the patient has physical symptoms and significant worry and complaints about their health with no organic physiological explanation. So in other words, they have this complaint or this specific issue, but we do a full workup and we can't find anything that would actually explain their symptoms. Now, we're going to talk specifically about three types: conversion disorder, hypochondriasis, and somatization disorder. But the one thing I want you to know is that all of these are heavily rooted in anxiety. So these disorders are usually how the patient, usually unconsciously, is attempting to cope with some kind of anxiety. So the first is conversion disorder. So anytime you think conversion disorder, I want you to think neurosymptoms, okay? Conversion disorder, neurosymptoms. So someone with conversion disorder is essentially converting their anxiety into these physical symptoms. So they could have really serious neurosymptoms like blindness or paralysis or numbness, or even I've seen people with hearing loss. So they've converted their anxiety. So we do this full workup because we have these serious symptoms and we can't find any physiological cause for their symptoms. So you may see something like a child who's been bullied who suddenly just stops talking, or someone who's had some sort of traumatic experience suddenly goes limp and is paralyzed. There's no physiologic cause, and usually once the mental or emotional issues are dealt with, some of these symptoms will resolve on their own. I've actually seen a soldier who was in basic training who just was so overwhelmed with the process, they literally passed out, went completely unresponsive, but physiologically they were perfectly normal. So that was a form of kind of a conversion response. Now, the second one is hypochondriasis. You may have heard the term hypochondriac. It's a condition where a patient perceives minor symptoms as some sort of major disease. So think of it this way. If you hear hoofbeats, right, 99 times out of 100, it's going to be a horse. There might be that one time that it's actually a zebra, but it's unlikely, right? So when you hear hoofbeats, you assume horse. Well, with someone with hypochondriasis, when they hear hoofbeats, they immediately assume it's a zebra, right? So they may get a headache, and as soon as they get a headache, oh my goodness, I have a brain tumor. So this can be really challenging because they are convinced that this is a very serious problem. So we want to make sure to be very detailed in our assessments and our diagnostic tests so we can help them understand that actually you're okay. There's just something emotional that's underlying this problem. So lastly is somatization disorder. This is the more kind of general somatoform disorder, sometimes also called somatic symptom disorder. And in somatization disorder, they've had multiple symptoms in multiple different body systems from an early age, for many, many years. So common issues is a lot of pain, maybe some digestive troubles. We've seen people with sexual issues, neurological symptoms, etc. But ultimately, again, there is no physiological cause for the symptoms they have going on. Now, it's also possible within somatization disorder that there actually is something wrong, but their symptoms and their complaints are way out of proportion to the true condition. So remember, this is largely based in anxiety, and sometimes it's this unconscious effort to maybe get attention or get out of responsibilities. But remember, it is unconscious. So the things that these patients are experiencing are very, very real to them. So the first thing we want to do, in addition to ensuring the safety of everyone involved, is we want to acknowledge those symptoms. We want them to realize that we recognize that their symptoms and experiences are very real to them. So, I do believe that this hurts. I believe that you're experiencing this pain. We give them a chance to kind of express their issues or their concerns, but we don't want to let them cycle or fixate on a specific symptom. So they may keep coming back to their headache. We want to kind of deter them or, take them off of that so they don't cycle. We also want to make sure that we're not encouraging them to go down these rabbit holes of thinking their condition's worse than it really is. If all the scans are clear, we give them some Tylenol, but we don't say something like, oh, well, I knew someone who had a headache and it turned out it was a stroke and she died. All that does is that makes them want to fixate on it more, and it can make it worse. So make sure that you're setting those boundaries and kind of being consistent with those boundaries. So as far as priority nursing concepts, you'll notice I didn't put safety here. Now, yes, safety is a priority for every single patient, every single time, but patients with somatoform disorders don't necessarily tend to be at as high of risk for self-harm or in any kind of danger as much as others do. So keep it in mind, but it's not at the forefront. What we do want to focus on is their mood and affect and helping them cope. Remember that all of this is usually rooted in some form of anxiety. And so we want to try to get down to that root cause and address that to deal with the rest of the issues. So let's recap. Somatoform disorder is when patients experience physical symptoms that don't actually have any kind of organic or physiological cause. Now, this is often related to anxiety, and it's usually an unconscious coping mechanism. So we want to acknowledge the experience is very real to them and allow them some structured time to express that. But we want to make sure that we set boundaries and we keep them from kind of going down this rabbit hole and fixating and cycling on their symptoms. We don't want to encourage that. Okay, so that's the basics of somatoform disorders. Be sure to check out the care plan and all the other resources attached to this lesson to learn more. Now go out and be your best selves today, guys. And as always, happy nursing.